So your dick doesn't work. Problems downstairs. If you're dealing with erectile dysfunction, most men straight away just assume their testosterone's low. And while that seems logical, here's the truth most men never hear. Low testosterone and erectile dysfunction are not the same thing. Although low testosterone can cause ED, it's not the most common reason your wife is tired all the time. Although confusing them is one of the reasons men chase the wrong solution and not the right one. Today we're breaking down what testosterone actually controls, what erections really depend on, and which problem you're really dealing with. We guys know test plays an important role in men's health, but its job is often misunderstood. Testosterone primarily influences libido or sexual desire, energy and motivation, mood and confidence, muscle mass, and recovery. However, the biggest misconception people don't realize, it doesn't actually control your ability to get or maintain an erection. This is why many guys with low testosterone can still get an erection and guys with normal testosterone can't. Testosterone sets the interest in sex, not the function. So the million-dollar question is, what causes an erection? Think of it as a vascular and a neurological event. For it to happen, three systems must work together. First, your blood vessels must dilate properly. Second, your nervous system signals must be intact. And third, your nitric oxide signaling must be strong. When arousal starts, blood vessels in your dick relax and fill with blood. If blood flow is restricted, signaling is blocked. Or if the nervous system is stressed, the erections weaken or fail. Now, this is why testosterone alone cannot fix a blood flow or signaling problem. This is where most guys go wrong. They see erectile dysfunction and immediately assume testosterone is the issue, when in reality, testosterone is often not the first bottleneck. Before hormones, there are several surprising, more common issues that affect erections. Number one, let's talk blood flow. Erections are fundamentally a blood flow event. Anything that limits circulation can weaken or stop erections. So, what directly affects blood flow? Early cardiovascular disease, high blood pressure, poor endothelial function, surprisingly, smoking or nicotine use, and then lastly, sedentary lifestyle. You don't need advanced heart disease for this to matter. Even mild vascular dysfunction can show up first as ED. Think of it like this: you don't need a fully clogged highway to cause traffic. Even a small lane closure can slow everything down. And ED is often the first place that you notice it. So this is why ED is often called an early warning sign, not just a sexual issue. Number two, now let's talk ED and stress. You know that deadline at work that you've been dreading? There's a good chance that can be tripping you up at the finish line. Chronic stress keeps the body in a fight or flight state. In that state, blood is diverted away from down there. Nitric oxide signaling is suppressed. Erections become inconsistent or even disappear. If erections vary based off of sleep, stress, or anxiety, then the nervous system is often the driver, not testosterone. You can't override a stressed nervous system with hormones. Number three is your sleep plays a massive role in your erection quality. Poor sleep can lower nitric oxide production, increase your cortisol, reduce nighttime erections, and worsen blood flow and signaling. Conditions like sleep apnea are especially important here and frequently overlooked. Number four is metabolic issues affect blood vessels long before symptoms appear. Insulin resistance and inflammation can damage vascular function, impair nitric oxide signaling, and reduce erection quality. Many men with ED have normal testosterone, but with underlying metabolic stress. Number five, did you know medications can directly interfere with erections, including antidepressants, blood pressure medication, stimulants, excessive alcohol or recreational drugs. In these cases, testosterone replacement doesn't fix the cause because the testosterone isn't what's blocking the function. So let's say all of these are in check. Now it's time to look at your testosterone. Here are the specific scenarios where your testosterone might be causing your situation down there. So here are the signs where your testosterone may be involved. Low libido and low interest in sex, few spontaneous or morning erections, fatigue and loss of motivation, and poor recovery and muscle loss. But even then, testosterone is often one piece and not the whole picture. Raising testosterone can improve desire and sensitivity, but erections still depend on vascular and nervous system health. Okay, so let's go over how to tell which problem you have. Here's a simple framework. If desire is low and erections are weak, testosterone may be involved. If desire is normal but the erections are unreliable, blood flow or signaling is likely the issue. If erections vary with stress, sleep, or anxiety, nervous system involvement is likely. But most men don't have low T ED. They have multi-system ED. The biggest mistake men make is guessing, jumping into hormones, pills, or other supplements. Without identifying the real bottleneck, it leads to frustration or lack of confidence. ED isn't about forcing an outcome, it's about removing a blocker. If you're dealing with erectile dysfunction, the goal is not to guess which lever to pull. It's to understand why things aren't working in the first place. That's why we've linked LifeRX below. LifeRX offers medical consultations that look at hormones, blood flow, sleep, stress, and metabolic health. So you're not treating the wrong problem. If you want clarity instead of trial and error, click the link below to book a consultation. Because when you treat the right system, everything else gets easier.